So today we are thrilled to have Dr. Michael Cafaro as our guest speaker. Dr. Cafaro is the Assistant Registrar for the College of Physicians and Surgeons of Alberta, who is responsible for continuing competence. He is also an RPAP board member representing CPSA. Today he will be speaking to us on the topic of physician assistants. So now I will turn things over to Dr. Cafaro.
Good morning, everybody, and welcome. So prior to my arrival in the Continuing Competence Department, I did also serve 4 years as the Assistant Registrar for Registration at CPSA. And so that is how I become involved with the activity around physician assistants in Alberta from a regulatory standpoint. But my exposure actually starts far longer ago. It was actually the fall of 1993. And I'm a brand new family doc in Hinton, and I have to admit a patient from the United States who has a rather significant infection. The individual gets better over the course of several days, and then we're at a point where I can then allow the individual to go home. And my comment as I left, as I provided him the summary of his care is, please ensure you see your primary care provider when you get home. I had a lovely card from him afterwards, a thank you when he got home, but he made it plain that when he arrived home, and I believe it was Montana, that his care was taken over by the primary care team, and in particular by the physician assistant who was actually providing the care as part of that team. So that's how I first became acquainted with physician assistants, and the hope is today that we'll have a little more knowledge out there for everybody in terms of physician assistants, the role they play on the healthcare team, and how we should be able to welcome them into an expanded role in practice within the province of Alberta. This is me and in my role here. Now, we have 3 guests with us today that I would like to be able to introduce, and if possible, if they're able to come off, have their video shown just for introduction. So first is Kirsten Luamala. Kirsten is an active PA. There she is, who is currently the president of the Canadian Association of Physician Assistants. And Kirsten, if you can come off mute, I must admit, I don't know where you actually practice. So I'm going to pin you down if that's okay.
That's okay. Just in brief, I'm a Canadian Forces trained physician assistant. I retired 11 years ago to take on the role of the sole neurosurgery PA in the province, and I work at the University of Alberta Hospital.
Thank you very much. And next up, because they've already preempted my request, we see Hannah Weens. Hannah, do you want to go ahead and introduce yourself?
Sure. My name's Hannah. I'm a physician assistant practicing in the Edmonton area. I'm civilian trained, unlike Kirsten, and I am the current Alberta director for the Canadian Association of Physician Assistants.
Great. Thanks very much and welcome, Hannah. And last but not least, Alana Takahashi. Alana.
Hi, I'm Alana Takahashi. I'm trained through the University of Toronto, so civilian trained as well. I work in Lethbridge in rural emerge, family practice, and addictions medicine.
Great. Thank you very much. And so, in part, I wanted, to have them here because in part, you're being introduced to 3 people who are physician assistants who are actually working in the province, who are actually providing care to patients. So these people really do exist, and they really do provide care. And in the case of what you've just heard, in areas that are specialized and not specialized. Briefly, who are the physician assistants? So PAs have a defined course of study. This is something that's called protected title. An individual cannot call themselves a physician assistant just because they're helping out a physician in an office or a particular setting. These are defined courses of study that give them knowledge, training to provide a broad range of medical services, which may be specialized or primary care-like within a healthcare team. The physician assistant does practice under the supervision of a physician or group of physicians and have been in existence, certainly within the Canadian Armed Forces, since the early 1960s. The PA is a little bit of a unique provider within the North American context The origin is, I believe, and Kirsten will, I'm sure, correct me if I'm wrong, the origin is believed out of the United States Armed Forces, and particularly as they traipsed through Southeast Asia in the late 50s and the early 60s. But there's now a significant amount of care provided in both armed forces by these individuals. There are currently more than 1,000 PAs working across the country, and that only speaks to the provinces that have them regulated. That is BC, Alberta, Saskatchewan, Manitoba, New Brunswick, Nova Scotia. The elephant of the room, Ontario, will be regulating PAs as of April of this coming year. And then, of course, that does not include the Canadian Armed Forces and PAs who work within that area. There are other provinces that are certainly also looking at the regulation of physician assistants because they are seen as being a valuable member of the team going forward. Now, Manitoba has the oldest civilian program in the country, but this is to give you a bit of a sense as to where PAs are training and what they're looking at in terms of the annual, if I can call it, output from these programs. And most of these numbers are updated because most of these programs have actually been very good about getting back to me with updated numbers. I did throw in the last line around the training that occurs in the United States because certainly the Americans have an outsized presence in the PA community in North America with regards to the number of graduates, and that includes both working in the United States Armed Forces, but also in civilian practice, where they are very well ensconced and have been for decades in a variety of care areas. Now, there is a formal certification process that does occur with the PA. And so, again, important to note that not only is it protected title, but these are individuals that not only have a training program, but then have to have be able to pass an independently administered certification examination through the Physician Assistant Certification Council of Canada. Now, American physician assistants are assessed through their own similar body in the United States with the requirement for ongoing continuing professional development thereafter. Interestingly, what we have done in Canada, in Alberta specifically, is we have recently changed our registration criteria for physician assistants so that the American physician assistant who is fully certified is now treated as an equivalent of a Canadian grad and can be registered on our full practice register for physician assistants in the province of Alberta. And I make note of that because certainly entities such as Alberta Health Services have begun looking south of the border for individuals and potential recruitment in the physician assistant world. Now, the PA, by and large, can work in almost any setting you can think of, where the physician also works. And the scope is going to be dependent very much on the physician-PA relationship. So Kirsten gave the example of working in a subspecialty area, but for many others who work in primary care, the physician assistant is going to be doing many of the same things. They'll be seeing and assessing patients, taking histories, doing examinations, taking care of investigations, interpreting investigations, helping out with procedures or performing procedures and assisting at surgery. It's important to note that the PA can often be providing care without necessarily having the physician, if I can put this casually, being in a whites of the eyes type of situation. So the example I gave of the patient I had years ago, he went back and ended up in the outpatient department of the local hospital where the physician assistant saw him, examined him, and arranged for follow-up care. The physician was not there. The physician was in the outpatient clinic separate from the hospital. And that is certainly possible in scenarios within the province of Alberta. We do not expect, nor would it be realistic, to have a PA in practice tethered to the physician, if you wish, with short apron strings. It would not be respectful of the skill set of the PA. Now, it is important, and I put this slide up because I've been asked about it before, to make sure that we're clear about sort of who does what in the system, especially because some of our nomenclature has recently changed. Now, physician assistants are neither physicians nor the independent practitioners. And it's important to demarcate their difference from associate physicians, or what we used to call clinical assistants. Associate physicians work in the healthcare system right now. They work in AHS facilities, and they also work under the direction of a physician. But they are not separately certified in the manner that physician assistants do, and require a different sort of assessment, training regime, and oversight in their practice. Nurse practitioners, on the other hand, are individuals who do work in an independent practice skill set and are overseen through the regulatory process by the nursing profession. Now, I want to point out the last line and talk about the setting of practice. The PA is able to work in a variety of different settings, unlike the associate physician. So you will meet a PA in a clinic setting. You'll meet them in an inpatient setting. You may meet them in an operating room or another specialized area. And again, not necessarily tethered to the physician or physicians that that are supervising them. Now, we began registering physicians in Alberta in 2021, and we've been able to create a reasonably, and I say reasonably, straightforward registration process for PAs that is on our website and not having to go through our national clearinghouse. Our average time frame for registration of a physician assistant in the last 2 years is about 30 days or less. Now, currently, and Kirsten hopefully will correct me if I'm wrong, we did have a difference in terms of when many civilian PA programs finished and when the certification exam was being offered. We do not see that, we do not treat that as a barrier to a PA coming and being registered in the province. The CPSA has what's called a provisional register. Some of you may be familiar with that from physician registration. And that provisional register allows the PA to practice in full scope practice whilst they are awaiting their certification examination. So just because someone has potentially graduated a civilian program in, say, August, and the exam is not till later in the fall, doesn't mean they can't necessarily be recruited and begin work in the interim. And we've certainly had some success. I believe Hannah may be one of them, with PAs being able to register and begin work in the province whilst awaiting the examination. Now, as of January, we have 64 physician assistants that are registered in Alberta. This number would be outside or beyond the number that may be present in the province working with the Canadian Armed Forces at any one time, since an individual practitioner working within the forces and only providing care to forces personnel does not have to register with us. Physician assistants have the same standards of practice applied to them that do apply to physicians. And the regulation makes it very clear that they are allowed title protection. Again, a physician assistant's a title that can only apply to someone who has the training and the certification to do that work. And it also talks about the skills and care that they can provide, as per the Health Professions Act. Now, you'll all get a copy of the slideshow later. Rachel Prado is a colleague of Alana, Hannah, and Kirsten's, who works in Alberta. She works in Sundre. And Sundre has taken a lead in hiring physician assistants to work in primary care outside of Alberta Health Services. As of last week, this QR code was still active. And so for anyone who's interested, you're more than welcome to scan and read a little bit about Rachel's journey, both in terms of coming to Alberta and in practice since. And what has happened in Sundre recently, and again, because they start off outside AHS, Alberta Health Services has been able to get us to the point now where Rachel and colleagues have access to privileges and can now extend their care into the in-hospital setting for patients that they are connected with. Now, the CAPA hosts PA positions that are available on their website, and it is a great clearinghouse of information for anybody that may be interested in looking at PA hiring a workforce, whether that be a physician, a local health authority, or a clinic organization. There are a number of other resources out there, and I didn't list them all, but Canadian PCA is a blog from a PA in Ontario that is certainly a very interesting read and has a lot of interesting connectivity across the PA profession in Canada, which I would certainly recommend as a point of interest. And I should mention, and again, Kirsten will correct me if I'm wrong, but I believe CAPA can also take postings for PA positions from those who are interested in hiring them and then repost them on their website. Now, very briefly, these are sort of the standard resources that we offer through CPSA in terms of information around physician assistants, the regulatory process, and also some emails that go to my old department as to the process of hiring a PA. This one, again, may be a more interesting slide, which talks about some of the external resources that are out there. And that includes both the Canadian and American certifying bodies. I understand that you've heard from Kirsten, her journey originally as a Canadian Armed Forces PA, now in civilian practice. I put the link for the Canadian Armed Forces up there because in your communities, you may have young people who are interested in a healthcare career and are undecided as to what they wish to do. There are the individual schools across the country that certainly can train a PA in a civilian milieu, but I would not want to miss the Canadian Armed Forces piece. For those that are thinking about, well, how can I maybe access or hire a PA? The armed forces in both the United States and Canada are every year seeing a number of PAs retire, but retire from the military life and then be in a position to move on to civilian life. And for any of you that may have been at Wainwright at our biannual conference, we met a number of PAs when we toured the base, and a number of them who indicated that they were looking at probably retiring within a couple of years and were hoping for a civilian career on an ongoing basis. So we know the individuals are there and are interested in practice opportunities, especially for those who want to stay in Alberta. The last two names I'll give as introductions here. They will be familiar to some of you. Michelle Warren is one half of Dr. Warren and Dr. Warren, who run the medical clinic in Sundre called the Moose and Squirrel. For those who wondered, the Moose and Squirrel was going to be the name of the pub that her husband was going to open, but instead he went to medical school, and so they named the clinic that. As mentioned, Sundre has an outside presence in PA practice in the private care world outside of AHS, and Michelle has kindly offered to be available to physicians and other colleagues who would wish to explore the hiring of a PA. Neil Gibson will be very familiar to Kirsten. Certainly, Neil is a regulated member. He's a physician who works in Edmonton. And before going into civilian practice, Neil was a practitioner of the Canadian Armed Forces. He has been a significant help at the onboarding of PA registration in the province and hiring within AHS. And Neil has similarly offered himself as a resource to individuals who are wondering about an application for a PA, and very specifically for those that are interested in PA presence within your facility that is run by Alberta Health Services, as an example. You might want to consider him as a resource as well. And with that, we've done a really quick tour through physician assistants, through what's out there in the ecosphere. And again, we've been joined by three of our colleagues who work in that area. And so, Anita, I think I'm going to turn it back over to you, and you're going to tell me what we're going to do next.
You bet. You rolled right through that, Dr. Cafaro. Thank you so much. I'm guessing there will be some questions that might be coming through the Q&A here. I do have one, and that question is, what is the difference in scope between an NP and a PA?
Well, potentially the scopes could look very similar, especially since the majority of PAs also work in primary care. The biggest difference is going to be that the NP is by definition someone who can be an independent practice and is not necessarily working under the direction and control, sorry, that's legal language, of another regulated member. That's what you have in the case of the physician assistant. But if you look at, pardon me for putting it this way, well-run primary care teams. So if you look at Kaiser Permanente or Intermountain Health in the United States, when the person identifies themselves, if you didn't know what their title was, you might not be able to tell them apart. And I'll put this bias out there as a former rural family doc. In a primary care team, the PA, the NP, and the family physician may oftentimes be indistinguishable with regards to the care and the interface with the physician. The one advantage would be, if I can say this, is an NP and a PA should be able to manage often on their own or with the appropriate supervision many of the typical primary care concerns that come into a family doc's office. If I can say this, saving the family physician to deal with all things that really do require a physician's attention, more complex cases, as an example.
Great. You may have already answered this then, but NPs can now build their own panel and bill patient visits. Can PAs do the same?
Oh, billing, money, the root of all evil. So let's just say there's a little bit of extra complexity in the Alberta healthcare system, which has traditionally been a barrier to many things around recompense for individuals. NPs can, if they are appropriately rostered with the government and if they commit to carrying the appropriately sized patient panel, uh, can be recompensed for that primary care they are providing. I admit that I do not believe that the NP is being recompensed on a fee for service or piecework basis like much of physician care is being recompensed. I believe it's block funding. Now, physician assistant, the recompense is going to be dependent on where they are working. Within Alberta Health Services, most PAs would, I imagine, be hired on a contract or salary basis, and therefore would have a set recompense based on the area of work that they are performing. In private practice, that's a different matter because right now there is no government support. There's no Alberta Health support for a PA in private practice. A physician is paying for the PA out of their own pocket or whatever other monies they can find. There are some interesting ideas out there around the co-op clinic model and a community-owned clinic being able to manage that. Primary care networks and alternate funding plans are also ways of potentially paying for this. But as an example, if you're in Sundre, it's very conceivable you're paying for the PA out of your own pocket, which, if I can say this, says something about the interest in and the professional of the physician who's willing to do this work to try to create new ground. So that is something that is of interest. I know within AHS, before the dismemberment started, there was interest in actually providing funding for positions for PAs outside of AHS in the community. I do not know, and I don't have knowledge as to whether that is still live within AHS at this time.
Okay, thanks. One more question here. My understanding is that many of the 64 PAs in the province are working in urban surgical programs. What, if any, barriers are preventing them from working in rural communities in primary and or full scope practice?
Well, thanks, Tracy, for that question. So you've run into the age-old question around what do people want to do and how are they recompensed to do the work that needs to be done? And in many ways, we've run into the same problem with physicians and certainly with NPs. There are many individuals who, by virtue of their previous work or personal circumstances, wish to be in an urban environment. Within an urban environment, as an example, or Metro Edmonton, Calgary, the positions that are available may very well be tied to specialty or subspecialty programs. So if you're looking at the reverse, how do we encourage people to go into rural? A couple of thoughts. Number one, you need visionaries. If I look at what Rob and Michelle Warren have done in Sundre, that would be one example. So looking at those AHS sites and leaders locally, and it's usually local leadership that have said, let's do something different. You need a community of providers that's willing to do it. The funding certainly needs to follow, and it's easier if it is attached to an AHS facility at this point. It's not impossible, but there is that piece. And I will remind everybody, we now have completed a memorandum of understanding between government and physicians on a new primary care funding model. And it is possible, because there's still details being worked out, that some elements of that funding model may be leveraged to allow for the hiring of these individuals like PAs in a rural practice, as an example. That's one where I think individuals would need to have that sit-down chat with their local physician workforce in terms of what to be able to do that way. So that would be a big part of it. Unfortunately, oh, thanks. And Kirsten actually just noted that Hannah is apparently dedicating some of her brain power to assisting with funding outside of AHS. So there's work to be done. There's no question about that, but there is no simple answer at this point. There's possibilities, though.
Thank you. Here is one more question. Why would a physician have any interest in paying the PA out of his own pocket? What benefit is that to the physician? How would it be best to create a relationship between a PA and a physician?
Well, let's go to the last one first. We are very fortunate that we have some physicians in the province who know PAs. They know PA work, whether it's through Canadian Armed Forces or other examples. People like Michelle Warren and Neil Gibson offering themselves as a resource is probably the first way. People that, a physician can phone, or a clinic owner or a manager can phone and say, hey, tell me a little bit about how this person might be able to help. Some of it will be personal relationship, and anybody who's a caregiver on this call will know that the community of practice that you can build is what's going to attract you to practice and keep you there. And that goes beyond just the relationship between the PA and the physician. It's the physician and all the team members, as an example. The benefit to the physician, well, it's not necessarily measured in dollars and cents. It is the benefit that they can actually provide care to a larger number of physicians, large number of patients, and especially with, again, the memo of understanding between government and the AMA, is an opportunity now to actually be recompensed for that without necessarily having whites of the eyes contact. I mean, that would truly extend the reach of the physician and, unburden them from, pardon the expression, under the current system, having to see every face that walks in the door, which is, with some exceptions, the way you get paid right now. So it's a way of extending that care, providing care to a large number of patients. At the end of the day, you actually may end up with not only happier patients, but happier staff, because they have a provider that can actually see a patient when Dr. So-and-so is busy. So that's really important to keep in mind as well.
Okay, the first cohort of PAs from the new U of Calgary program will be graduating in 2026. Does CPSA have inclination on where those 20 PAs will be looking to be licensed and possibly practice?
So the training program, the master's program for PAs at the University of Calgary is run solely by the U of C. We have some connectivity to them because these students have to register with us as students. I can tell you, and I don't think it's a secret, that each one of these PAs has been told by Alberta Health Services, as an example, as you're getting close to graduation, please come talk to us first, because we will have work for you somewhere in the province. This is going to be the case in every province that is training PAs. And again, as Hannah or Alana or Kirsten may speak to this more, in primary care, let's face it, it's an arms race across the country in terms of how you attract individuals to a province, whether they're a physician, a nurse, a PA, and give them a sense they can have a meaningful and successful practice in the province. So certainly there is interest. Interest has been expressed directly to this class. I can guarantee you, though, that's happening everywhere across the province. Oh, it looks like Kirsten's offered to throw herself out there with a few comments. So let's take advantage. Kirsten.
Thanks, Michael. So in our discussions with the government, as well as with U of C, who of which I am a guest lecturer for their program, the focus is to try and get them into rural primary care. And this is actually helping us with our discussions with the government in regards to funding models, because they want to make sure that all 20 of these graduates stay in Alberta and not go to the other provinces. So they know that there's a timeline on this, that the first class is graduating next summer in 2026, and we're starting the interviews for the second class. So there's a lot of movement moving on this, and I'm quite hopeful there'll be some funding models in place by the time they graduate.
Well, that's that's wonderbar to hear. I mean, certainly one would like to think that it should be all in on primary care and all the members of the primary care team when it comes to funding. There may be some distractions in government circles these days. Let's hope that the people that can make some decisions and can do the work remain focused on this, as I'm sure they are, because there's people that are still trying to think ahead, as you say, to when these people actually will graduate.
Is there anything more that you wanted to add, Dr. Cafaro?
Well, I think the one outstanding question I would have for everyone is, as you talk to your community members, as you talk to your healthcare providers, as you talk to those who have responsibility for Alberta Health Services, or Covenant, or other health authorities in your community, the pertinent question to ask is, how do we look at expanding our footprint in primary care? Are we really making the best use out of each individual in the community, and who are the right people to bring in as a mix to that primary care team to make it sustainable? There are many communities who will possibly never be able to bring in the full complement, or what they think is a full complement of physicians, but so many well-run primary care systems. I've mentioned a couple, Kaiser Permanente and Intermountain Health. So many well-run systems do not depend just on the physician. They depend on the other members of the team. And I think we are uniquely placed in this province at this time, with a new school coming on board and with the renewed interest in PAs, at expanding that healthcare team, for the benefit of all the Albertans we serve, especially those who are outside Metro Edmonton and Calgary.
But I want to thank Dr. Cafaro and our guests with the Canadian Association of Physician Assistants for today's very informative session.